Hello, good morning. Candidate number is 2169. My name is Ahmed. I'm one of surgical doctors here. May I confirm your name and age, please?
Hello, doctor. My name is Peter. I'm 65 years old.
Nice to meet you, Mr. Peter. Today I'm here to ask you some question regarding condition and taking some notes will be confidential. Is that okay with you?
Yeah, it's fine.
How can I help you today, Mr. Peter?
Doctor, I have severe back pain. It's troubling
I'm so
me.
so sorry, Mr. Peter. It must be frustrating.
Yes,
Would you like
doctor.
me to prescribe a painkiller?
No need, thank you. It's fine.
Mr. Peter, could you tell me more about this pain?
Yeah. I have this pain for a long time, but in the last 1 month, it started getting worse. So that's why I came here.
I'm so sorry, Mr. Peter. Could you please, Mr. Peter, the way exactly you feel the pain? Could you tell me?
At the lower of my back.
This pain starts suddenly or gradually, Mr. Peter.
No, it started gradually.
Could you describe this pain for me?
You can say it's dull pain.
Mm, Mr. Peter, is the pain go anywhere else?
No,
Is it come and go or it's all the time?
this most of the time.
Mr. Peter, anything make it better?
I think taking a rest and taking some painkiller make it better.
Anything make it worse?
Yeah, it's getting worse when I go to the wall.
Mr. Peter, I see. Could you score this pain for me in a scale from 1 to 10, 1 being the lowest, 10 being the highest?
Oh, I can say it's 7.
Oh, I'm so sorry, Mr. Peter. Are you sure you can continue, Mr. Peter?
Yeah, it's fine.
Okay, Mr. Peter, do you have any history of trauma to your back?
No,
Any swelling in your back?
no.
Do you have any history of heavy lifting?
Yeah, actually, I have. As I work in a store, so I have to
Um,
lift heavy object.
okay. Mr. Peter, do you investigate for this pain?
Yeah, I visit my GP last year. He do a sort of scan called MRI, and he said that I have I don't know what called degeneration or something like that. But it went fine, so I didn't go back for him.
I see, Mr. Peter. Mr. Peter, do you have any numbness in your legs?
No,
Any weakness in your legs?
no,
Okay. Mr. Peter, do you have any problems with your water work or bowel work?
no,
Any numbness in your private area or back passage?
no.
Any difficulty initiating erection, Mr. Peter?
What?
So sorry for this question. Do you have any difficulty initiating erection?
No,
Okay, Mr. Peter, do you lose your appetite?
no, it's fine.
Do you have unintentional weight loss?
No,
Do you have cough?
no, I don't have.
Any shortness of breath for a long time?
No,
Do you have any neck swelling?
no,
Mr. Peter, do you have any stiffness in your back at the morning?
no,
Do you experience fracture on your bones with minor trauma?
no.
Okay, Mr. Peter, before I go any further, could I ask you what do you think the cause is?
I don't know. I think it may related to this heavy lifting.
Okay, Mr. Peter, what do you hope from us to do?
I hope you can give me a solution for this, as I have to work hard to feed my children.
I see, Mr. Peter. I see, Mr. Peter. Don't worry, we are here to support you. What's your most concern about?
My concern is about my job, as I have to work. I can't stop
Yes.
working.
I see, Mr. Peter. Do you have any past history of similar condition?
No, just I have this problem for a long time.
Okay. Do you have any previous surgical operations?
No.
Any medical problems?
Yes, I have high blood pressures for which I take amlodipine 10 milligram.
Okay. Mr. Peter, do you have, okay, time's up. I took a clinical history for this gentleman, Mr. Peter, 65 years old patient, known case of hypertension, for which he taking amlodipine 10 milligram. He has presented with long-term history of back pain, for which is become more severe in the last 1 month. Um, Mr. Peter has he investigated for this. He has a degenerative disease. Also, his history of heavy lifting, as he's a worker in store. Um, the pain worsening by movement and relieved by NSAIDs. So my main differential diagnosis is a mechanical back pain.
Okay, what is the other differential?
My other differential, it could be ankylosing spondylitis, Pott's disease, osteoporosis, and um,
Anything more serious you want to
Codequina,
exclude?
Codequina syndrome, compression of Codequina.
Uh-huh. Okay, how to investigate this patient?
Firstly, I will start by doing full clinical examination to this patient, including back examination, neurovascular examination to the lower limbs. Then
Mhm.
I'll order blood investigations, CBC, and inflammatory markers. Okay. Then I will do lumbosacral X-rays. Then I will go for lumbosacral MRI, and also I will go for um, the DEXA scan if crushing is suspected, and chest X-ray and quantiferon gamma assay to exclude the tuberculosis.
Mhm. Okay. I have to manage this patient.
I will manage this patient in a multidisciplinary team,
Mhm.
starting by general approach. They will consider contact with the GP and take all the notes regarding this patient pain. Okay, and also consider physiotherapy, analgesia, and refer this patient to social worker. And um, then, okay,
And what is the code
analgesia,
equina?
analgesia okay,
What is code equina syndrome?
Co- called equine syndrome. Compression of the spinal cord below L2.
Mm-hmm.
Come with lower motor neuron manifestations like weakness of the lower limbs and
Okay,
weakness
how
of
to
the.
manage this patient if you suspect the compression of the spinal cord, how the management will be?
I will give him dexamethasone and decompression discectomy and decompression laminectomy.
Okay, thank you.